New York passing a sweeping abortion law allowing many abortions up to the day of birth.
Another New York national precedent will be established. The most aggressive women's equality platform in the nation is going to be in law in this state. And that's the way it should be.
But our next guest, an OBGYN who says he delivered more than 2,500 babies, tweeted, "There's not a single fetal or maternal condition that requires a third trimester abortion, not one." That Dr. Omar Hamada, and former Army surgeon, joins us now to explain. So, sir, tell us what you meant by that.
Hey, Katie. Basically, in the third trimester of pregnancy, there is not a single condition that requires an abortion. There's not a single condition that requires that we kill the baby before delivery. There are several things in third trimester pregnancy that require that we deliver the mother, and that is a fact, but there's not a single thing that actually requires us to kill the child.
So this New York abortion law, which allows abortion up to the day before birth, essentially then is a recreational abortion bill.
Well, it does three things. It actually removes all the protections for the fetus by removing any homicidal protections. So before, the New York Penal Code basically stated that after 24 weeks, if a baby was killed, there was a risk of the perpetrator being charged with a homicide. That's been removed. It allows for any healthcare practitioner that's licensed or authorized, as the legal terms in the bill state, to perform an abortion. So it doesn't have to be a physician, and it removes all restrictions at all for any type of abortion at any time for any reason.
So when you heard about this law and the cheering inside of the chamber, what did you think about that?
I thought it was a travesty. Literally, I mean, it tore me up because I'm thinking, you know, there are some reasons that we will end a pregnancy, like an ectopic pregnancy in the first trimester or other reasons in the second trimester, but there's absolutely no reason to end a pregnancy so that the child dies in the third trimester. There are genetic malformations and other anatomical things that happen where the child will end up succumbing. Well, there's no reason for us to do it. So it tore me up. It's unconscionable.
Does a bill like this go against the medical code and doctors' ethics when you say first do no harm by not trying to save the lives of both the baby and the mother in the third trimester?
It certainly does. You know, we take the Hippocratic Oath, but some of those terms have been removed from the Hippocratic Oath recently, but it does go against what we do as physicians in terms of saving lives and comforting patients.
So you're a professional, you're a doctor, you've delivered 2,500 babies, but you've gotten threats for coming out and quoting medical science and your experience.
Yes, definitely. And I had a little trouble hearing you. I think you said I've gotten flack for that.
Yes,
is that right?
threats. Talk about some of the threats that you've gotten for speaking out as a medical professional about what this bill actually means.
Well, remarkably, there's a group of female physicians and nurses that have come out very hard trying to threaten my career. I've gotten some death threats already, which, you know, I don't really take seriously, but it's on social media. And also, they've done some other untowardly things that, you know, trying to shut me up, I think.
When they say that they want to threaten, when you say that they want to threaten your career, or do they not think that you're a qualified physician, considering how many children you've delivered and your experience in the area of women's health?
Well, of course they do, but they don't like what I'm saying, so they are trying to shut us up, shut me up, and shut others up that believe like I do. And I think that's just a common method that the left uses. They want to invalidate and destroy. There's no understanding, there's no desire for common ground. All they really intend on doing is trying to invalidate and destroy because they want what they want when they want it.
In your professional medical opinion, what do you think the medical implications are for this legislation?
I think it's going to, of course, increase the number of abortions that are done in the state of New York, and it's going to have a lot of people gravitate to that state where other states are more restrictive. I know here in Tennessee we are trying to pass a heartbeat bill just like Iowa just did, and that is our hope, to protect the unborn, to help mothers, and to also just promote life.
Well, Dr. Hamada, we really appreciate your perspective this morning. We did reach out to Governor Cuomo's office and haven't heard back. So thank you so much for sharing your professional medical opinion with us. We appreciate it.
My pleasure. Thank you, Katie.